Welcome to this video on gas formation and management. We will explore the etiology and pathophysiology of gas production, differentiate between gastric and non-gastric clinical causes, and review evidence-based interventions for prevention and reduction. In this video, we summarize the core takeaways of gas and digestion. We will cover the primary sources of gas, common clinical signals that may point to underlying issues, and actionable management steps to improve digestive health. Why does gas form in the stomach? The most common cause is aerophagia, or swallowed air. This can be triggered by eating too quickly, talking while eating, chewing gum, consuming carbonated drinks, or rapid breathing associated with anxiety. Gas also forms in the intestines through fermentation. When food is not fully broken down, gut bacteria ferment it, producing gas. Common triggers include beans, lentils, dairy and lactose-intolerant individuals, high-fiber foods, certain artificial sweeteners, and wheat for sensitive individuals. Reduced digestive efficiency is another major factor. If stomach acid, digestive enzymes, or bile production are insufficient, food moves into the intestines undigested, leading to increased fermentation and gas production. Several medical conditions in the stomach can contribute to gas. These include gastritis, H. pylori infections, acid reflux or GERD, delayed stomach emptying, and various food intolerances. These are possibilities doctors will consider during evaluation. Gas can also stem from issues elsewhere in the body. Potential sources include conditions in the small or large intestine, such as SIBO or constipation, pancreatic enzyme insufficiency, gallbladder problems, or systemic issues like diabetes or thyroid disorders. To reduce gas formation, consider these general strategies. Eat and drink slowly, identify your specific food triggers, stay physically active with gentle walks, use over-the-counter enzyme aids if necessary, and avoid chewing gum. You can slow down digestion triggers by eating more slowly, avoiding conversation while eating to reduce air intake, limiting carbonated beverages, and avoiding straws and chewing gum, which often lead to swallowing excess air. Try a 7-day observation process to adjust for food triggers. Keep an active journal to identify which foods cause issues and systematically eliminate one category, such as dairy or wheat, at a time to isolate the trigger. Improving gut motility is key to digestive comfort. Simple habits like taking a 10 to 15-minute walk after meals, choosing warm water over cold drinks, and eating smaller, more frequent meals can naturally stimulate your digestive system. To support digestion, doctors may suggest enzyme supplements to ease the workload, probiotics to balance your microbiome, peppermint tea to relax muscles and soothe spasms, or ginger to help with gastric emptying. Reducing constipation is essential for digestive health. Establish simple daily practices such as maintaining proper hydration, balancing your fiber intake to avoid extremes, and setting consistent times for bowel movements to support your body's natural rhythm. Managing stress is vital, as it directly impacts your digestion. Stress can increase the amount of air you swallow and physically slow down your digestive tract, disrupting your body's natural rhythm. Finally, know when to see a doctor. Seek medical evaluation if you experience persistent pain, weight loss, vomiting, blood in your stool, worsening gas over time, or significant changes in your bowel habits. Let's begin with step 1 of our management plan, mapping your typical daily pattern. This is a foundational exercise to help us understand your specific habits. Start by identifying your morning routine. Note what you usually drink, such as tea, coffee, or juice, what you eat, and any supplements you take. Keep it brief. Next, consider your afternoon. What are your typical lunch foods and snacks? Be sure to note if you frequently consume any carbonated drinks during this time. Moving to the evening, take note of your dinner, any late-night snacks, and whether you have a habit of lying down shortly after you finish eating. Finally, review your general habits. Do you eat fast or slow? Do you use a straw or chew gum? Also, note any stress during meals and whether you suffer from chronic constipation. Once you have documented your pattern, we move to step 2, mapping your answers to the 6 major gas pathways to identify what is affecting you. These pathways include swallowed air, food fermentation triggers, digestive inefficiency, gut motility issues, food intolerances, and constipation-related gas. Step 3 involves building a tailored plan. A professional can help you design a strategy that aligns with your specific habits to reduce gas. This plan may focus on meal timing, food substitutions, digestion habits, swallowing fixes, constipation prevention, and a formal clinician evaluation if needed. Let's review why gas forms. Swallowed air happens when eating fast, talking while eating, or drinking carbonated beverages. Bacterial fermentation occurs in the colon. Keep in mind that passing gas 14 to 25 times a day is considered normal. It is a fundamental part of the digestive process. Certain medical problems can increase gas, such as gastritis, acid reflux, gastroparesis, and various food intolerances like lactose or gluten sensitivity. We must also consider conditions beyond the stomach, including SIBO, IBS, celiac disease, constipation, pancreatic insufficiency, and gallbladder issues. Common gas-triggering foods include beans, cruciferous vegetables, high-fiber fruits, dairy, sugar substitutes, and whole grains. Tracking these is vital. Finally, manage symptoms by slowing down, adjusting your food choices, improving digestion with movement, and knowing when to see a doctor for persistent symptoms. This video covered the essentials of gas formation and management. If you notice persistent warning signs like severe abdominal pain, unexplained weight loss, or changes in your stool frequency and appearance, it is critical to consult a healthcare professional for a formal evaluation. Thank you for joining this session on digestive health. We appreciate your time and interest in exploring these topics. For further resources and information, please visit the links provided on the screen.